It is Dr. Palm. I'm at Art of Skin MD with the lovely Christy Cashman, one of our non-invasive body contouring experts. And we thought we'd do a quick lunch and learn and talk a little bit about Coolsculpting because we are running a little special this month and it's called New Year, Cool You.
Cool You.
And in order to achieve this bikini bod that this cute little snowboarder coming down the hill is transitioning into summertime, as we all know.
Yes.
Summer bodies are made in the wintertime.
Correct.
We really need to think ahead. And so for people with areas that they've been working on hard, they've got their New Year's resolution, they're on the right diet, they're doing their good strength training, and they're doing their aerobic activity, and things are improving, but they've got stubborn areas.
Exactly.
Tell me what role Coolsculpting can play.
Coolsculpting is perfect for those stubborn diet and exercise resistant areas. We are able to target pinchable fatty tissue, so just right under the skin, and we can really sort of tune to the areas that you're concerned about. So we have different types of applicators, different sizes of applicators that will kind of target the areas, you know, just a little bit here, a little bit there. We are able to do 9 different areas, FDA cleared for 9 different areas on the body. We can do tummies.
Basically from the submentum, which is double chin, underneath your chin, the neck area,
down to the thighs. We are able to really refine those areas. We're able to really sculpt and tone those areas. Coolsculpting is actually takes about 2 treatments, at least 2 treatments for most patients, for your average patient. Sometimes we can get away with 1, but it's pretty rare. It's great to come in for a consultation first so we can kind of see what your target, your goal is. And we also like to let you know that it does take at least 3 months from your final treatment to see your results. So now is the time to get started before summer if you're, if you have some summer goals. Again, we have different sizes of applicators, so we're able to get little areas like the submentum. We're able to get a little bra fat here. We've got larger applicators for the tummy, for the flanks, love handles.
Well, I would say the thing that I think you and Ricky are really exceptional about because of your experience. I mean, you've been doing this over a decade. You taught Coolsculpting Academy, so you were teaching, new little fledglings on proper techniques, safety, effectiveness of the treatment. Is not only on the bespoke manner in which you deliver treatment, and what that really means is tailored treatment. So, for example, I mean, we've talked about this before. I literally, all of us are a little asymmetric. And one little area of bra fat here. And so we did Coolsculpting with one of the chin applicators in this area with excellent results. I know you've shown before and afters on our Art of Skin Body Instagram as well, demonstrating some of these before and afters. And in addition to sort of, I think, really tailoring treatment, critical to what we do in aesthetics, whether it's facial analysis, if we're doing injectables or light treatments or energy-based devices, but I think even more critical in some of the body work we do, whether I'm doing something like liposuction or you're doing something non-invasive, is analysis. Facial analysis, body assessment, which is mainly what we're talking about, unless we're talking about the area underneath the chin. But I think you guys being able to personalize treatment, but what I love, because yesterday you had a long case in the afternoon where you were doing multiple applicators, I think what you really specialize in as well is full body transformation. So circumferentially treating the midsection. We hear so often women perimenopausally because of how our metabolism changes, how hormonal fluctuations, and then sometimes dietary changes as well. We just hold on to this mid-central, what we call adiposity or fat deposition. It's just unwanted, and women will say, what happened to my waistline? In addition to sort of getting the body right, these are one of those things that we can do to really help with pinchable fat.
Absolutely.
And I think demonstrated by over 100, I mean, it's probably at this point over 150 clinical studies that have been published. So it's tried and true technology. I think Christy and Ricky do an amazing job of really going through the process with you, setting expectations, going over the possible sort of side effects, which I think are quite minimal. And in the vast majority of patients, they get a little numbness in the area. It feels cold during the onset of therapy. Exactly. It becomes a little numb during the rest of treatment. You have some numbness in the areas because we're temporarily sort of stunning some of the sensory nerves. But that returns. We get asked a lot about paradoxical adipose sort of hypertrophy, which means getting fat actually growing in areas that we've treated with cold temperatures, such as Coolsculpting. It's exceptionally rare. We knock on wood. I've never had it here at Art of Skin MD, but it is treatable if we were to have it. And I think it's much more likely when you look at the cases. It's usually about 1 in 3,000 cases. It tends to be very low fat percentage and tends to be more male than female.
Right, more
so
fibrous.
So I think we kind of know what to look out for, and we do have other technologies. If that's a patient sort of fits into that paradigm, we're much more likely to use heat and muscle toning than we are to use sort of Coolsculpting. But what I love is we tend to use Coolsculpting for debulking. So if people are like, I don't want the downtime of a surgery like liposuction, they've got good skin elasticity. This is an awesome way of us, over a couple of treatment sessions, being able to treat multiple areas.
Volume first, and then we can go in with another technology to help to either tighten the skin a little bit or tone those muscles. So you're just getting that whole body treatment where we're reducing volume and then toning and cinching things back in. So
because we can't see our six-pack if there's a little layer of fluff there. So I think, if that's an area that's concerning and you've tried all of the good measures and you're on a good system, this isn't a means of weight control, but it really is a means of somebody who's on a healthy path but just needs a little help along the way in stubborn areas. So maybe we can talk about the special that we've got going on.
Fabulous special this month, just this month. You can purchase 3 applications. So applications are each time I place this applicator. So 3 applications get 1 complimentary, or 4 applications get 2 complimentary. So it's a really nice deal. It is a savings of it can be up to about $2,000. So really helps in that area. And we do offer complimentary consultations, and we're now here Monday through Friday. We have Fridays. So both Christy as well as Ricky are here on Fridays, and they are just a wealth of knowledge. I think when it comes to this, both of them have been providers that have treated me personally. So you're in exceptional hands. So please call us. We're on lunch break right now, but we're here Monday through Friday with the exception of lunch break on Pacific Standard Times, 8 to 5. You can give us a ring if you have questions. They would love to sit down and explain the technology a little bit more. And then finally, when I do post this under some of the written, we want to help people in the LA fires a little bit. And I'm in a little yoga group, and friends of friends have identified some families in need in the Altadena fires. And these are personal stories that you can read about. So I will create a link to a Google Doc, and there's some GoFundMe. If you are choosing charities to help with the LA fires and really want more personalized stories with families that really have lost everything and really could use your help, we will make sure to do that. We're certainly thinking of Dylan and Brian, so they are husbands of staff members. And Brian got called up there on Sunday and is fighting the fires right now, and Dylan is supporting the LA teams as well. So we want to thank them so much. They're all so brave, and people do not realize that they literally sleep on fire trucks and engines and in the cold and work hours without much sleep, rest, or nutrition, and they're the true heroes in this. So really our thoughts go out to the people in LA. They're our sister city just a couple hours away, and we're gonna, in our small way, try and provide a link if you're interested in helping someone that's in need. Fabulous.
Okay. Well, thank you guys for tuning in. We'll post this, and hope everybody's safe this week. Okay. All right. And I'm gonna old-fashioned just end this on my own.